My name is Elizabeth Klisle, and I work in the Division of Healthcare Quality Promotion at CDC. We are excited for our presentation today. We will have two speakers for the webinar. During the presentation, facilities will have the opportunity to ask questions using the chat function. And when asking a question, please indicate your facility type, as this will help us to better assist you. After the presentation, we will go into the live Q&A portion. Also, the slides being used today will be posted on the NHSN website over the next 1 to 2 weeks. So before we go into the formal presentation, I wanted to briefly go over a few slides. There are several types of facilities that report COVID-19 vaccination data to CMS. So because of this, we recommend that facilities contact CMS with questions about reporting requirements using the email addresses provided here. Next slide, please. Also, we've included a slide about upcoming CMS deadlines, in particular, quarterly deadlines that you can review here. So now I will turn things over to our first speaker, Cherise Denard, who is a health educator with NHSN.
Thank you, Elizabeth. Welcome to the Refresher Training and Updates session on reporting COVID-19 vaccination data. My name is Cherise Denard, and I work with the Division of Healthcare Quality Promotion at CDC. There are two objectives for today's webinar. The first objective is to address 3 recent changes and updates made to the modules, which are inclusion of vendors as other contract personnel, medical contraindication after 1 COVID-19 vaccine dose, and the removal of the current question 4 on the data collection form pertaining to those eligible to receive an additional or booster dose of the COVID-19 vaccine. During the second half webinar, my colleague Jolie will review how to accurately report cumulative COVID-19 vaccine data in NHSN. Please note that these slides will be posted to the NHSN COVID-19 vaccination websites within the next 1 to 2 weeks. We will now review recent changes and updates to the weekly COVID-19 vaccination data modules. During the November 2021 training, which covered frequently asked questions for data entry, CDC instructed users not to include vendors as healthcare personnel. Since that time, and after hearing from facilities and stakeholders, the guidance has been updated to now include vendors under the other contract personnel category of the data collection form if they regularly work in the facility each week, regardless of clinical responsibility or patient contact. CDC recommends that facilities follow this guidance moving forward, and if possible, revise data reported for prior weeks. Please note that the guidance was updated due to the risk by vendors who are regularly in healthcare facilities in terms of transmitting and or acquiring COVID-19 infection. This slide and the next slide covers a list of roles that are often occupied by contracted and vendor HCP and should be included in the data collection if they regularly work in the facility. These non-employee providers may or may not be involved in patient care. This list was previously included in the data reporting protocol for the COVID-19 vaccination module and has been expanded and added to the FAQs to include vendors as part of the other contract personnel category. This list can be used as a reference, but it is not all inclusive. This slide is a continuation of the previous slide and also covers a list of contracted and vendor HCP. Facilities are encouraged to consult CDC guidelines using the link listed on this slide for the most current information on medical contraindications. It has been clarified that an individual who has a severe allergic reaction after one dose of a COVID-19 vaccine should be classified as a medical contraindication, which is question 3.1, rather than a partial vaccination, which are questions 2.1 and 2.3. Medical contraindications are comprised of having a history of severe allergic reaction to vaccine or components such as those shown here. Please note that only those who meet this definition, contraindication, should be reported as having a medical contraindication. If someone has a medical exemption that does not meet this definition, they are reported as declined vaccination. In the February 2022 release of the NHSN application, the question on the data collection form asking for facilities to report the number of individuals eligible to receive an additional or booster dose of the COVID-19 vaccine is being removed. This was previously question 4 on the form. Removing the question on the number of individuals eligible to receive an additional or booster dose will simplify reporting for users. In addition, more individuals are now eligible for booster dose 5 months after receiving their primary series vaccination. So it was no longer necessary to collect. The image on this slide is how the screen will appear with the eligibility question removed. Note that with the eligibility question removed, the question on the number of individuals who have received an additional or booster dose, which was previously question 5, is now question 4. The data tracking worksheet was updated on NHSN web pages January 11th, 2022. An email was also sent that day to inform facilities. The data tracking worksheet is currently built into NHSN. NHSN is working to create a new functionality in the application to allow users to make person-level tracking worksheet in the application. Information about training opportunities is coming this spring. Now we will review a few frequently asked questions. Question 1. Sometimes individuals are granted a religious or personal belief exemption to COVID-19 vaccination according to their facility's policy. Please note that an individual who declines to receive vaccination for any reason other than the medical contraindications listed in interim clinical considerations for use of COVID-19 vaccines currently approved or authorized in the United States should be categorized as declined to receive COVID-19 vaccination for question 3.2. This is true even if your facility permits religious or philosophical exemptions for COVID-19 vaccination. Next question. An individual received the first dose of a primary COVID-19 vaccine, but had a severe allergic reaction to this. As a result, the individual did not receive the second vaccine dose. How should we categorize this individual? The individual should be categorized in question 3.1 as having a medical contraindication to COVID-19 vaccine due to their severe allergic reaction after a previous dose of COVID-19 vaccine. Question 3. CDC has also decided to change guidance on counting vendors working in healthcare facilities. Vendors providing care, treatment, or services should now be included in the other contract personnel category if they work in the facility on a regular weekly basis, regardless of clinical responsibility or patient contact. CDC will notify facilities about this change in the coming week. Let's review with an example. Vendors or sales representatives come into my facility or unit and may be present during surgeries or other patient care activities. Should we count these vendors in the other contract personnel category? The answer is yes. Vendors providing care, treatment, or services should be included in the other contract personnel category if they work in the facility on a regular weekly basis, regardless of clinical responsibility or patient contact. Question 4. It can be common for an individual to work in multiple facilities. In these cases, all eligible individuals must be counted at each facility where they work during the week of data collection. This is important since these reports describe vaccination rates among individuals working at a specific facility. If an individual is scheduled to work at least one day each week at 3 separate facility locations, then that individual will be included in the data for each of the 3 facilities. And question 5. Facilities can contact CMS with questions about reporting requirements using the email provided on this slide and on the slide shown at the beginning of the presentation. I will now turn it over to my colleague, Jolie Siegel.
Thank you, Charisse. Now we will go over where and how to enter cumulative data in the NHSN COVID-19 vaccination modules. Firstly, we will address the question of what cumulative data are. Cumulative vaccination data are the total number of individuals in the facility who have ever received the COVID-19 vaccine since it became available. This is in contrast to incident vaccination data, where the number of new individuals who received a COVID-19 vaccine in a specific week. Please note that incident data are not used for reporting COVID-19 vaccination data in NHSN. I will now discuss where cumulative data are reported for the NHSN COVID-19 vaccination modules. Question 2 in the reporting form asks about the cumulative number of individuals in question 1, the total for the reporting week, who have received the primary vaccine series. Question 4 asks about the cumulative number of individuals who have received an additional or booster dose. These doses would include a third dose of the Moderna or Pfizer vaccine or a second dose of the Janssen vaccine. Before we move further, I want to emphasize that the remainder of this presentation will refer to the question asking about the cumulative number of individuals in question 2 who have ever received an additional or booster dose. This used to be question 5, but is now question 4 since the eligibility question is being removed. This question is reflected in the screenshot. Now we will go over how to report cumulative data for both question 2, primary series, and question 4, additional or booster doses. We will start with question 2. Firstly, in the application, you will select a vaccine type as seen in the screenshot shown on this slide. Next, you will enter the cumulative number of individuals who have ever received dose 1 of the vaccine since it became available in December 2020. Lastly, you will enter the cumulative number of individuals who have received both dose 1 and 2 since December 2020. Please note that you must take into account vaccine manufacturers. After you enter the number of individuals who received the doses for one vaccine manufacturer, go back and repeat steps 1 through 3 to enter data for individuals receiving vaccine from another manufacturer. Now we will go over an example of reporting cumulative data for question 2. Say for week 1, you have 50 individuals in the facility. 10 of them have received the first vaccine dose, and 5 have received the second vaccine dose. Now, for week 2, nothing changes except that 5 more individuals received the first dose of the vaccine. You would report 50 people in question 1, no change, 15 people in question 2.1, taking into account the addition of 5 more individuals, and then in the last row, 5 individuals in question 2.2, no change. By week 3, 3 more individuals received the first dose, and 10 more individuals received the second dose. With these additions, this would bring your total up for question 2.1 to 8. This is because we add 3 to the existing 15 from week 2, and then subtract 10 individuals who no longer fall into this category of having received dose 1 since they have received their second dose. The 10 individuals who received their second dose will be added to question 2.2, which gives you 15 as a total. Now we will go over how to enter data for question 4, additional or booster doses. The first step is the same as question 2. Select the vaccine from the drop-down menu. Secondly, you must enter the cumulative number of individuals in question 2 who have received an additional or booster dose. Please note that a number must be entered even if no individuals have received the booster. If this is the case, please select one manufacturer and enter 0. Now we will go over an example of how to enter cumulative data for question 4. Say for week 1, you have a total number of 50 individuals at the facility. This number would be recorded in question 1. Of these 50, 20 have received dose 1 and 2 of the vaccine, and 5 have received an additional or booster dose. These numbers would be reported in question 2.2 and 4.1. For week 2, you have the same number of individuals at the facility, 50, and now 5 more have received the first and second dose, and 1 has received an additional or booster dose. For week 2, you would report 10 plus 5 equals 15 in question 2.2, and 5 plus 1 equals 6 for question 4.1. For more examples on how to report cumulative data, please see our Quick Learn demonstration on YouTube at the link above. Finally, some reminders of common reporting mistakes. Firstly, if you have no changes in your data, carry the same numbers over from last week to the current week. Secondly, please try clearing your cookies if you have technical difficulties. Lastly, remember that every question on the form is based off of the number of individuals reported in question 1. For example, the number of individuals receiving boosters or additional doses can never be more than the number reported in question 2. The number of individuals receiving an additional or booster dose can also never be more than the number in question 2 who have received a complete primary series. Now we will go over a few resources that may be helpful to facilities. This slide covers who is considered eligible for an additional dose or booster of COVID-19 vaccine according to the latest CDC guidelines. Facilities should refer to the link listed on the slide, CDC's Interim Clinical Considerations for Use of COVID-19 Vaccines currently approved or authorized in the United States to determine individuals who are eligible to receive additional doses or boosters after receiving an initial completed vaccination series. Those eligible to receive an additional or booster dose vary by factors including vaccine type, age, location of residence, underlying conditions, and occupation. Please use the link on this slide to access the COVID-19 modules and dashboards from the NHSN homepage. The facilities component website contains links to a variety of training materials. Direct links to the facilities are listed on the slide. The link on this slide will take you directly to these resources. You will also see a tab on this webpage to access FAQs. If you have any questions about NHSN, please send an email to usersupport@nhsn@cdc.gov. Please include weekly COVID-19 vaccination in the subject line of the email. This concludes the presentation. Thank you so much for your time. We will now have the opportunity to answer questions. I will turn things back over to my colleague, Elizabeth.
Thank you, Jolie, for reviewing data reporting. So we received several questions during the webinar, and we can use the remaining time to answer these questions. We also have members of the NHSN vaccination unit present today, including our unit lead, Hannah Reeses. So now we'll go through some of the questions. We did have one question from long-term care facilities, and they asked about flu vaccination reporting and if that's mandatory for NHSN. So in this case, for long-term care facilities, they are not currently mandated to report annual flu vaccination data. Previously, we had the option for long-term care facilities to report weekly flu vaccination data. However, we suspended that for this current flu season. So I hope that provides clarification for that question. So we had another question about community access hospitals and if they are required to report the COVID-19 vaccination healthcare personnel data to NHSN. So in this case, we normally advise facilities to contact CMS just to get confirmation for individual facilities and clarification on their particular reporting requirements. So we do have that slide. I believe it's pulled up now for your facility type to use the email provided on the slide just to get additional information on reporting requirements. And if a facility needs to report the data to NHSN, or if they need to report data for completion of state or local requirements. So thank you for that question. So we did have another question. The question reads, I work in a long-term care facility. Does this mean, for example, a lab technician who does not regularly work in the facility, even though they are working with patients, does not need to be included in the reporting? So I will turn that over to my colleagues to see if they can provide a response.
I'm sorry, Elizabeth, can you repeat the question?
Sure. So the question reads, I work in a long-term care facility. Does this mean that, for example, a lab tech who does not regularly work in the facility, even though they are working with patients, does not need to be included in the reporting?
Thanks, Elizabeth. For this question, I would say that the lab tech should be included in the reporting for the long-term care facility if the lab tech is in the physical building on a regular weekly basis, meaning they come into the building at least once per week on in general from week to week. So if the lab tech does not come into the building and works in a completely separate facility, then no, they would not be included.
Okay, great. Thank you so much, Hannah. So another question comes from a facility saying, why can't you choose different vaccines to report? Not all of our employees' residents receive Moderna, for example, but I can only choose one, so I end up reporting all as being Moderna. So for this question, we want to point out that there is actually a drop-down box in the NHSN application where facilities can go into the reporting form and click on various vaccine types to report data. So for example, a facility would go in and use the drop-down box and select Moderna vaccine and report individuals who received that particular vaccine. And then once that is completed, you can actually go back to that drop-down box and select a second vaccine. So for example, you can select Pfizer and then report data for all the individuals who received the Pfizer vaccine. So that drop-down box does have that capability for facilities to report on multiple vaccines. So these are all very good questions. So thank you for submitting these for our attention. We did have some other questions about the slides and reporting forms. So the slides used for today's presentation will be posted on the NHSN website within the next 1 to 2 weeks. And the data reporting forms and updated CSV files and instructions will be posted on the NHSN website by the end of this week. So this will be aligning with the February release, which is on the 10th of February. So we have another question, and it pertains to the data tracking worksheet that is posted on the NHSN website. And the question reads, I am already populating the spreadsheet for February 6th through February 13th. It is not the new versions. Will I need to re-enter data into the new version? And I believe Heather DeBendris would like to answer this question.
Hey, Elizabeth, thank you. This is Heather. I just wanted to clarify, there's been a lot of questions about if data are going to need to be re-entered. The NHSN application performs updates throughout the year based on changes that come up. And so just to clarify, any data that's already been provided in the application, there's never a need to re-enter that data. It's just that these changes are being made as of the February 10th date. So data that's already been uploaded does not need to be re-uploaded or re-entered.
Okay, great. Thanks so much, Heather. So we do have another question here. It says, what about the oxygen delivery person? Do they need to be reported? They come in weekly, but no resident contact, just to deliver oxygen to the room. So if this individual comes in and, for example, if they're paid through a contract, they would be considered other contract personnel. And if they are scheduled to come into the facility on a regular basis, even though they don't have patient contact, you would actually include this individual in your data reporting. We have another question asking if an individual, if they work a shift such as 8 hours, if they come in for less than an hour, should they be counted? So this really comes back to our guidance on healthcare personnel and how they should be counted if they're working any part of a day. So for example, if someone is scheduled to work in the facility every week, and even though they may come in for, let's say, 20 minutes each week, that individual should still be counted in the data. We've also had some questions about religious exemptions and how they are categorized. So if someone has a religious exemption to COVID-19 vaccination, they should be categorized as declining vaccination, and that is consistent with the guidance that we have been giving for the NHSN COVID-19 vaccination modules. Some facilities have had questions about penalties or fines. We cannot answer those questions, but we recommend that facilities contact a state health department or regulatory authority to get more information on that issue. There is another question about staff who work on laundry services and dietary services, but they do not work in the building. So the question is if a facility should count those individuals. So for our data reporting, any staff who do not physically work in a building would not be counted in the data. We've also had some more questions about the data tracking worksheets. So we have updated the data tracking worksheets for 2022. Those are currently posted on the NHSN website. And we are now in the process of building those Excel worksheets into the NHSN application. We expect that to be completed later this spring. And then we will have some information about future trainings and other details. We will send out through blast emails and other communications so that you can receive training on how to use that worksheet and how it really functions within the NHSN application. We had another question from long-term care facilities, and they're asking if they should update the information if there is a change, and they said otherwise it's very time-consuming. So I will turn this question over to my colleagues for a response.
So Elizabeth, if the question is about the change for the vendor, for the question 4, is that the question?
No, so it looks like the individual is asking about changes to data on a weekly basis. So for example, if their data do not change from week to week, do they still have to enter the data in the NHSN application?
Thanks, Elizabeth. So NHSN does recommend weekly reporting. Whether or not a facility is required to report weekly varies by the facility type. But if you are reporting weekly and have no specific changes from week to week, you can go ahead and enter that same data again. And for questions on how frequently you should report, I would refer you to the contact information on this screen for your facility type.
Great, thank you so much, Heather. And we're also noticing several questions have been coming in about COVID cases and testing. So for the COVID-19 vaccination modules, we just wanted to clarify that we are collecting data on vaccination status. So questions about cases and testing should actually be directed to NHSN at cdc.gov. And once you send those questions to NHSN, they will be routed to the appropriate team. So they will be able to provide you with a response. So these are questions that are actually outside of the scope of our work in these modules. So we did have another question about when an individual is counted as contraindicated after they receive 1 dose, this person should be excluded from the count in section 1 for dose 1. And if an individual has received 2 doses, the individual will be excluded from the count for section 1 for dose 1 and dose 2. So I'm going to ask Hannah to handle this question.
Hey, Elizabeth. Sorry, I didn't catch all of it as I was responding to another question, but regarding dose 1 and dose 2 and medical contraindications, is that what we were talking about, Elizabeth?
Yes.
Okay. Yeah, so if someone has dose 1 and then has a severe allergic reaction to dose 1, such that they cannot receive dose 2, then our updated guidance is that we are going to count this person under the medical contraindication category rather than the dose 1 partially vaccinated category. However, if someone has complete primary series vaccination, meaning they've received dose 1 and dose 2 of an mRNA vaccine, or if they've received a dose of Janssen vaccine and they have a contraindication after that, we don't need to count that anywhere because the medical contraindication category is only in relation to the primary series. So those people would be counted as complete primary series, and all of their vaccination data would be collected under question 2. And for the booster dose, you just would not count them as having received a booster dose.
Okay, great. Thanks so much, Hannah. So another question that has come in is, are we responsible to include outreach medical providers that come in only one day on a quarterly basis? So in this situation, the answer is no. You only need to include individuals who work in the facility on a regular basis, and so that means a weekly basis. We had another question asking about, will existing data load into the new February 2022 form, or do facilities have to manually populate the data? So in this case, any data that was provided through NHSN prior to the February release will actually remain saved in the application. So as a reminder, for facilities, once you go in and enter and save your data, it will remain there. And then also facilities have the option to go back and edit their data. So you can go back to previous entries, edit your data, and then just make sure that you click on that save button to make sure that your changes are retained within the system. And then we do have some questions about if individuals are regularly scheduled to work in the facility and how they should be counted through that definition. And we advise facilities that in general, if you have questions about who to include in your data, we always have the table of instructions available on our website. And the table of instructions really goes through all of the fields in the application and has a thorough explanation of the questions on the form and where to count individuals. So just wanted to have that reminder again. Another topic that has come up during the live chat session is that some facilities report that they cannot obtain the vaccination status of the other contract personnel. So here at NHSN, we do realize that tracking the vaccination status of non-employee healthcare personnel can be challenging. So we encourage facilities just to do your best when reporting the data and continue to work on developing methods to identify healthcare personnel who are eligible to work in the facility and also obtain their vaccination status. It is the first year reporting and it's a new requirement. So there is always some challenges that present themselves. And we also wanted to point out that if you're unable to determine the vaccination status for an individual, then he or she can be included in question 3.3, and that is unknown vaccination status for the COVID-19 vaccination modules. There is also a question about updated tracking forms for ASCs. And they're looking for facility-specific forms. So for ASCs and as well as other facility types, reporting through the healthcare personnel safety component, you can actually go to the NHSN website and look at the forms which are currently labeled for non-long-term care facilities, reporting data for healthcare personnel, and you can access the data collection forms and table of instructions and other materials such as training slides. And these are universal forms that ASCs and inpatient rehab facilities and acute care hospitals can all use. So we just wanted to clarify that as well. And then we do have another question that has come up. It says, can you please explain who should be included in the licensed independent practitioner category? And that is a very good question because licensed independent practitioners are restricted to a few different types of contracted personnel. So those are contracted physicians, advanced practice nurses, and physician assistants. So for example, if you had a physician who was paid through a contract, then that individual should be counted in the licensed independent practitioner category. However, if you had a physician who was considered to be an employee of the facility, meaning that they received a direct paycheck from the facility, then you would actually count that physician as an employee in the employee category. And then to further explain that, if you have a advanced practice nurse who was paid directly through the facility, he or she would be counted in the employee category. However, if the advanced practice nurse was paid through a contract, then he or she would be counted in that licensed independent practitioner category. And thanks again for all these great questions. We're seeing some questions about reporting deadlines and frequency of reporting. So I know that we have several different facility types who are listening in on this call. So in terms of frequency of reporting, it does vary by facility type. So we do recommend that you contact CMS just to verify requirements and reporting deadlines. So that's why we included those two slides on today's presentation, just so that you would have that as a reference point, and hopefully that will be helpful. But it's always good just to verify with CMS to make sure that you're reporting as specified and on the schedule that they have sent out in terms of their guidance. So we do have another question here about lab technicians who come in on a regular basis and if they are counted. So if you do have lab technicians who are scheduled to work on a regular basis every week, then they would be counted in your data. However, if your facility contracts, for example, with an agency to provide lab technicians at your facility and to provide services. And but they send different people into your facility every week. And so they are not the same people coming in on a regular basis. Then you would not count those individuals. So we want that consistency in terms of having facilities count the people who are scheduled to work on a regular basis. We have another question here that says, if people are available to work but don't actually work, should they be counted? So to explain this, I will give an example. So let's say someone is scheduled to work in the facility every week. For example, there's a nurse who comes in on Mondays and Wednesdays. However, if, for example, someone is sick and they're unable to come in for a week, but then they return the following week, you would still count that individual in your data since they are normally scheduled to work in the facility. So even if they're out for maybe a few days, you would still include that person in the data. However, if they're out for more than 2 weeks, then you would not count that individual. So for example, if someone is away on, let's say, maternity leave for 3 months, then you would not count that individual in your data. Well, it looks like we are coming to the end of the hour. I just wanted to say that we appreciate all of the time and effort that you have spent to collect these valuable data. Again, please reach out to us if you have any additional questions. You can always send an email to nhsn@cdc.gov. Just remember to put COVID-19 vaccination in the subject line of your email. And then if you could also specify your facility type, that will also help us to provide you with a faster response. So thank you again, and good afternoon.